Cognitive behavioral therapy, CBT, how it helps with anxiety and depression. Have you ever thought about why some thoughts can make you feel like they're controlling your life and making simple jobs seem impossible? What if there was a way to get out of these bad patterns and take back control of your thoughts and feelings? A lot of people know that cognitive behavioral therapy, CBT, works to help people with mental health problems, especially when it comes to treating anxiety and sadness. It focuses on changing the way you think to change your feelings and actions for the better. CBT was created by Dr. Beck in the 1960s. Its goal is to change and address negative thought patterns in order to promote a healthier mental attitude and useful ways to deal with problems. Cognitive behavioral therapy, CBT. What you need to know? Based on cognitive theory, CBT is an organized, goal-oriented type of therapy. There's an idea behind it that our thoughts, feelings, and actions are all linked, and that changing one can cause changes in the others. For example, if someone always feels like they're not good enough, they are more likely to be sad and act in ways that support this view. Cognitive behavioral therapy, CBT, tries to break this loop by helping people see and change their wrong ways of thinking. Important parts of CBT. Cognitive restructuring means recognizing and questioning damaging or skewed thoughts, like "I'm not good enough" or "everything will go wrong." Patients are told to change these negative thoughts into more balanced and realistic ones, which can have a big effect on their mental health. Behavioral activation. This part is all about getting people to do things that make them happy or fulfilled, even if they don't want to at first. Behavioral activation can help break the cycle of avoiding things or not doing anything that comes with sadness and anxiety. Mindfulness and present focus. Mindfulness methods are not part of traditional CBT, but they are often used to help clients focus on the present moment instead of worrying about the future or regretting the past. This part is especially helpful for dealing with worry, which often makes people think too much about the future. What CBT can do to help with anxiety? Anxiety disorders such as generalized anxiety disorder, GAD, social anxiety, and obsessive compulsive disorder, OCD, are marked by worrying and being afraid all the time. CBT is a very important part of treating these illnesses because it helps people figure out and deal with the things that make them anxious. How cognitive behavioral therapy, CBT, can help treat anxiety? Identifying and dealing with cognitive distortions. People who are anxious often think in skewed ways, like expecting the worst to happen or jumping to conclusions about a whole group of events based on one small one. Cognitive restructuring, CBT, helps people see these trends and change their thoughts to ones that are more balanced. Exposure therapy is a type of cognitive behavioral therapy that is often used to help people with certain fears or OCD. This method, called exposure and response prevention, ERP, lets people slowly face their fears in a safe setting. Someone who is afraid of getting germs might be asked to touch something dirty without cleaning their hands right away. This would help them learn to deal with their anxiety instead of avoiding the thing that makes them anxious. Third, learning coping strategies is an important part of cognitive behavioral therapy, CBT, for anxiety. Deep breathing exercises and gradual muscle relaxation are two coping skills that help people deal with the physical effects of anxiety, such as a racing heartbeat or shallow breathing. What CBT can do to help with depression? People who are depressed often feel sad, helpless, and like they have no reason to live or an interest in life. People who are depressed may have automatic thoughts, which are bad thoughts that come to them without much thought and make them feel worse. Cognitive behavioral therapy, CBT, helps people recognize, question, and change their automatic thoughts, which leads to healthier ways of thinking and, in turn, better mental states. The cognitive behavioral therapy, CBT, method for treating depression. People who are depressed often think negative thoughts about themselves, such as "I'm worthless" or "nothing will ever get better." Through cognitive behavioral therapy, CBT, people can become aware of these trends and understand how they affect their depressive symptoms. People who are depressed tend to stop doing things they used to enjoy. Cognitive behavioral therapy, CBT, helps people do these things again by encouraging them to use behavioral activation. This can help their mood and drive over time. Depression can make life's problems seem impossible to handle. Cognitive behavioral therapy, CBT, teaches people how to solve problems, which helps them deal with problems in a more organized and reasonable way. This can help them feel like they have control of their lives again. Different kinds of CBT. Cognitive behavioral therapy, CBT, is an umbrella word for a group of different types of therapy that all work on changing thought and behavior patterns, but they do so in different ways. Albert Ellis came up with REBT, which is based on the idea that our thoughts and feelings about events, not the events themselves, affect how we feel and act. CBT helps people figure out their irrational beliefs like "I have to be perfect" and replace them with beliefs that are more flexible and reasonable. CBT was first made by Dr. Marsha Linehan to help people with borderline personality disorder. It stresses how important it is to accept your ideas and feelings instead of fighting them. It teaches skills in 4 main areas: being aware, dealing with stress, controlling emotions, and getting along with others. CBT has been changed to help with other problems like anxiety and sadness. The science behind why CBT works is one of the types of treatments that has been studied the most. Studies have shown that it works very well for both anxiety and sadness, sometimes even better than medication alone, especially for mild to moderate cases. CBT has long-term benefits because it teaches patients skills they can use outside of therapy meetings to help them become their own therapists. Based on research, it looks like cognitive behavioral therapy, CBT, can change how the brain works. Neuroimaging studies have shown that CBT can change activity in parts of the brain that are involved with mood control and thinking. Unlike traditional psychoanalysis, CBT is usually over in 12 to 20 meetings, which makes it easier for many people to use. Medications versus CBT, how to pick the best treatment. Psychotherapy and medication are both good ways to treat anxiety and depression, but which one to choose relies on the person. Medications can help ease symptoms, especially in serious cases, but they might not change the way you think or act that is causing the problem. Cognitive behavioral therapy, CBT, on the other hand, is very good at helping people understand and change the way they think. A lot of people find that CBT and drugs work best together, especially when they are first starting treatment. Treatment helps get to the root of problems, and medication eases symptoms so that patients can participate more fully in treatment. Because it saves money, insurance plans may favor medication over therapy, but mental health workers usually recommend a balanced approach that includes therapy. How to begin with CBT. There are many ways to get cognitive behavioral therapy, CBT, such as in-person meetings, online therapy programs, and self-help books. Online therapy sites like BetterHelp and Talkspace have made CBT easier to get to in recent years, letting people do treatment from the comfort of their own homes. The first thing that anyone who is interested in CBT should do is talk to a licensed mental health worker. This person can figure out what the person needs and suggest a good treatment plan. How to get the most out of cognitive behavior therapy? Cognitive behavioral therapy, CBT, is based on setting goals, so working with your therapist to make clear, attainable goals can help you keep track of your progress and stay motivated. As part of cognitive behavioral therapy, people are often given homework to do, like writing in a journal or trying new skills. When you do these routines, they can make therapy a lot more effective. It's hard to change the way you think, and it takes time. Enjoy the little wins along the way. The benefits of cognitive behavioral therapy, CBT, are greater when you go to meetings regularly and fully participate in the therapy process. One of the most effective ways to treat anxiety and sadness is cognitive behavioral therapy, which helps people understand and change the way they think. Cognitive behavioral therapy, CBT, helps people deal with their symptoms and feel better generally by reorganizing their thoughts, changing their behaviors, and building their skills. CBT is still an important part of mental health because it works and can be used in different ways to meet different needs. It gives people the power to take charge of their mental health and live better, more balanced lives. Cognitive behavioral therapy, CBT, is still one of the best ways to deal with and get over anxiety and sadness. It can be used by itself or with medication, and it can lead to a healthier, more resilient life. If you're finding this helpful and want more content that brings clarity and practical solutions for mental health and personal growth, hit that subscribe button and join our community. Don't miss out on our upcoming videos. Your journey to a better mindset starts here.